All right. No, well,
Truly.
I used to say bam, but there was always like a 30-second delay from when I said bam and when we actually went live. So, so that now we're slowing down. We're slowing it down. Okay, let's see. Ceremonial sip. We are live on YouTube. Hello, YouTube. Give us a couple of seconds, and while you join us, I never really have a huge YouTube live following. It's obviously a lot smaller than TikTok. I've seen a couple of people. I don't know what it must be a feature they're rolling out to certain users where they can do a live on TikTok, which I would love to do, and they can invite guests. So I
They're
would really
doing
like
that
that.
now? Oh my gosh, that'd be awesome.
They're doing that now. Yeah, I thought it was because Gary Vee had something called the All In Challenge, and he basically had all these people. You know what? I don't even need my phone for this. He had there we go. He had all these famous TikTokers, celebrities, musicians come in and they join. Hello to Prativa. And then they joined in and they said hi, and he interviewed them, and it was for charity or something. He raised like a lot of money, like $500,000 in 12 hours. It was really
Holy
cool.
smokes.
Right. And I was like, oh, I was like, maybe that's a feature that TikTok only did for Gary Vee. But no, I saw someone. It was a relatively small channel. It was just one. It was a Scottish singer that just blew up, and she was interviewing someone. I'm like, huh. So I wonder
Wow.
what it takes for us to get it. Yeah, I mean, come on.
Yeah, I know.
They're skimping on us.
You have
We
a
would
blue
love
check
that.
mark yet?
We
I don't
would
have a
love
blue
that.
check mark. I want a blue check mark. Give me a
I
blue
want a blue
check
check mark. Yeah, blue check mark. Okay. Well, let's go ahead and start recording. Are you ready?
All right. Yeah.
All right. Okay, we're recording. Hello, everyone. Welcome to the Hybrid Calisthenics Podcast. This is your brother Hampton from Hybrid Calisthenics. I'm here with Dr. Chris Cooper of Cascade Chiropractic and Wellness. How are you?
Very good. Thank you for having me, Hampton.
Oh, well, thank you so much for coming on. And I tell a lot of people this, but I also say during the recording, I really admire your content. I really like that you're using something that some people consider TikTok stupid because we met on TikTok. But I tell people, well, TikTok is just a platform. It's just a stage. We're the ones that are stupid.
Yeah.
So, and you're filling it full of health and good stretches, health advice, chiropractic. So I really appreciate that. I really admire your content. Thank you so much for doing that. And of course, thank you so much for being here.
I appreciate the kind words. I think it's awesome. I think that TikTok is a place where when I joined it, I was like, well, is this just a bunch of like dancing teenagers? But it's been a source of immense education for me. Like I've been able to network with other medical doctors, other healthcare professionals. I watch you all the time. I love the body
Likewise.
weight exercises you're doing. It is fantastic. Like the stuff you do is like legit. Like I'm not joking. It's legit. It's awesome.
Well, I'm glad you like it. And I confess there's a lot of things that I was ignorant on that I learned from TikTok on chiropractic and some physiotherapists that I've really learned quite a bit. And I've had a chiropractor a couple of times on my podcast before, but of course we have new subscribers. For someone who is just watching this, some people are not sure what chiropractic is. Can you summarize that for them just real quick?
Basically, chiropractic is a musculoskeletal specialist. If it's a muscle problem, if it's a bone problem, if it's a nerve problem, we could probably help. We are like the car mechanic for your body. We just, you got a weird tweak, I could probably figure out what it is and help you fix it. And the nice thing about chiropractors, at least in the United States, is we're a portal of entry doctor. So you don't need a referral to see us. You could just walk in off the street. But we are within the medical field, and so we can bill insurance. We follow the same guidelines. So we often work with local doctors to refer back and forth because we treat pain really well. And a lot of medical doctors, their pain solution is opioids. And so the shift has begun where the medical profession has been referring us a lot of back pain patients because the research shows that chiropractic helps back pain really well. And it helps people not take as many opioids, which is a good thing in the long run.
Now, what is an example of something, and you don't have to say definitively, of course, because it's a case-by-case basis, where the medical field may not help as much and they may refer to you often because it's something they think chiropractic can help with most of the time?
Chronic low back pain is a huge one. That one's been researched over and over and over again. And chiropractic always comes out on top versus pain medication versus the control. And so a lot
Mhm.
of doctors will refer to me for chronic low back pain. But headaches are another one that's a common one that gets researched over and over and over again. So those are the ones that the research heavily supports. But those are the, like, I've met with medical doctors in Portland. I work in Portland, Oregon, and so I met
Okay.
with medical doctors in Portland, and I'll ask them, like, so what's like the hardest cases you have to treat? And they always say it's the back pain because they don't really have any great solutions. And
Mm.
so by making that connection, like, they could refer patients to me for the chronic low back pain. And they come in with weird stuff that I'm like, you should go check out your primary care doctor because I'm not that guy. But it's
I
like,
see.
yeah,
So that's actually something that I get asked about a lot, and oftentimes I give a general answer, but sometimes I don't know because I mean I don't have an X-ray. I'm not there with them in person.
yeah,
But low back pain is something that's very common. So let's break that down a little
yes.
bit. What is usually causing their low back pain? Is it pelvic tilt?
Well, that's a cause.
Hmm.
There's so many things that can cause low back pain. It's kind of ridiculous. The list might be 100 long.
Hmm.
But usually when I'm doing an exam, someone walks into my clinic with, like, hey, doc, I got low back pain. I've had it for 10 years. Nothing helps. Um, First, I ask them a whole bunch of questions to make sure it's not something bigger and scary like cancer.
Hmm.
And once we got that out of the way, like, okay, it's not a kidney problem. It's not a cancer. It's not some sort of strange neurological lesion or something. Usually, with a history, a really thorough history, the right questions to ask, you could rule that out pretty quick. And then I take them through a range of motion. Do they move funny? Can they squat right? Can they, like, is it some sort of biomechanical dysfunction? Like, they just don't move right. All right, okay, they move well. Well, let's see segmentally. I'll push on the joints. Oh, there's something stuck. Okay, well, let's unstick it. Or there's something kind of, you know, tilted a little bit. Let's
Hmm.
untilt it. Uh, is there a knot in a muscle? Maybe you are activating a certain muscle more than you should be. In the case of like pelvic tilt, like you brought up, maybe their glutes are underdeveloped and their psoas is really tight and their erector spinals are really tight. And so there's this imbalance front to back. So there's just a lot of weird things you can check.
Hmm.
Today I had a patient, chronic low back pain. I took an x-ray of her and she had a sacralization of L5. It means her L5 was just misshaped. Like, it
Hmm.
has an extra piece on it that attaches to the sacrum that most people don't have.
Like
And
from
so
birth.
from birth, it just grew that way. And so there's, that one is like so specific. It's like, hey, what stretch can I do to fix that? There is none. There is none. And so it's more of keeping her mobile with an adjustment to make that joint move well. And then, you know, helping her stay active. Like, the more active she is, she'll probably be really good. So I
Okay.
don't know. There's a lot of stuff.
Yeah, there's a lot of stuff. And again, just a quick touch upon for some people that are unfamiliar with chiropractic. When you say adjustment, what do chiropractors do?
Yes.
When they say they need an adjustment in the lower back, how do you break that down a little bit for us?
So so it kind of varies from chiropractor to chiropractor. Most chiropractors use our hands, and so it's like a push through a joint space. And so pretend my hands represent two bones and the space between represents the joint. What I'm trying to do is move it. And sometimes it's move it. Or sometimes it's move it. And so we're trying to move a bone through a joint space. And so sometimes it's a stuck joint, like I try to move and it won't, and so we make it move again. And sometimes it's, slightly out of place and crack it back so it's nice and even again. And that's really crude way of just describing what it's actually happening, but that's kind of what's happening. It usually involves it's called a high velocity, low amplitude thrust. Just you see it on the chiropractic videos,
Mm.
people crack, oh yeah, crack me. That's kind of what's happening. It looks super simple, but we're just pushing a joint through its physiological space to induce motion or slightly realign.
Okay.
Usually
And
done by hand,
usually done by hand.
not always.
No, what's another way?
So sometimes we'll use something called a drop table. The chiropractic table goes and comes up and down, and we'll push that way. Just a way for people who might be in a lot of pain, they can't handle it. Sometimes we'll use a tool to do it, where it's like a percussive sort of punch. The tool will kind of push like that.
Gotcha.
But most chiropractors use hands.
Okay.
Actually, the word
Go on.
chiropractic means done by hand.
Oh, really? Actually,
The word chiro, the Greek, the Latin Greek or whatever, wherever it came from, chiro means hand, and practic means done by.
Wow.
Done by
That's
hand.
very interesting.
Mhm.
And you touched upon this, and you mentioned at the beginning of your answer that there are different approaches to this. What chiropractic approach, sub approach, I would say, do you subscribe to? And within that, what is your personal approach, your personal preference for treatment?
So I kind of follow the latest research and the latest biomechanics. So I'm kind of a very musculoskeletal sort of guy. There's a lot of chiropractors that kind of get into the very holistic, natural medicine sort of stuff. And I just kind of laser focused on movement, biomechanics, pain reduction, that I've kind of left that stuff to the wayside.
Okay.
So a very biomechanical approach. But my personal approach is I come at you from a full body, like you see the skeleton behind me, and I say that person has, where am I? Shoulder pain. Well, is it just that joint, or could they maybe have a collarbone involved, and an elbow involved, and a neck involved, and a thoracic spine involved? And so there's a lot more that plays in that just like, hey, it hurts right here. Well, there might be something going on here. And so I'll often kind of take a step back and address their full body to make sure everything top to bottom is working well. It just seems to hit all the spots, and usually people walk out. I get better results that way.
Okay, great. That makes a lot of sense. We got a lot of questions from the audience, and even within that,
Yes.
I had to choose several. And in a second, while you're answering, I'm not trying to be rude. When I'm scrolling through my phone, I'm looking at new questions that we've gotten that we'll see. But before I get into all of them, we got some really wild ones.
I know. My favorite one. How did you get so cool? That's my question.
Yes, that's my favorite one.
How did you get so cool, Hampton?
Well, I answered this person and I said, well, we learned by watching you. So I watch other cool people and I try to emulate. I try to keep up. That's my answer to that.
Oh my gosh.
How did you get so cool?
I don't think I am. So
yeah. You know what? I'll change my answer to that. I'm not cool. I wish I was cool.
I think I'm a big old dork. I get so excited about this stuff. I nerd out all the time. I see your videos and I'm like, yes. Oh yeah. I love this.
Yeah. What some people don't realize, or they say, oh, you're so nice and this is so interesting. It's delightful in small doses. The people that know me, and all I talk about is push-ups and the triceps, and they're like, I don't care.
Push-ups again. We got it, Hampton. You like those one-arm push-ups. We got it.
There's a new thing. But there are some that you may not directly want to. Do you cover cases like weight loss? Do you get people asking you about that?
I know about it, but I don't treat it in my clinic, but I know quite a bit.
Okay. So because it was one of the first questions we got, I'll ask you, and you can we can pass it back and forth if you like. Someone asked, what can women after menopause do about crazy weight gain? Is there a chiropractic solution to that? Something that you know of?
Not super chiropractic related, but health in general. Menopause is part of just a normal cycle when you're as in women, their estrogen starts to lower. And so when the estrogen starts to lower, you start to see bone density loss as well as muscle loss. Muscle, as you know, Hampton, it burns fat. And so the more muscle mass you have, the more fat you burn. And so if you're losing muscle mass, it's just going to be a tendency. If you're eating the same amount, you're going to start gaining weight. And so you have to modulate how much calories you're bringing in, and you might have to increase your exercise load. And you should, in my opinion, start to increase weight-bearing exercise. So things that put stress on the muscles and bones, that will help keep your bone density high and also keep your muscle density high. And that's going to help weight loss, but also, with menopause, there's osteoporosis or osteopenia that happens with bone loss. So weight-bearing exercise, and luckily Hampton knows a few things about weight-bearing exercise. So I love it.
Right. Well, some people prefer to lift weight. Right. Some people build muscle. Some people like machines. And if you're worried or you can't afford it or you don't think you have time, then again, there's lots of body weight calisthenics exercises that you can scale easy to hard. There's always an easier or harder variation that you can try out. But great answer to that. Great answer. You brought some things that I didn't really think of. The next question, and I bring it up so fast is because we were talking about it earlier. Because you mentioned lower back workouts. Sometimes you need can do. This person got in a car accident and they said they had terrible lower back pain at sometimes. Is there any, I realize you're not seeing them, but are there any good workouts they can give them?
So a typical car accident, if your back is hurting, there's probably going to be some sort of instability going on. When you're in a car accident, there's so much force that gets transferred through that seat into your back that something can get strained or sprained. And you could sprain your back, just like you sprain an ankle, you could sprain your back. And so anything that promotes stability will be the best. And so one of the reasons I love your stuff, Hampton, is because a lot of your exercises are isometric, which is excellent for stability. So building lower core stuff, posterior core, front core, side core stuff is going to promote lumbosacral stability. And that's what you want. And usually an isometric sort of thing is where you want to go. So something like a side plank can be really beneficial. A normal plank, bridge poses are like wonderful for instability in the low back. And it doesn't have to be hard. It just has to be nice and simple like that.
So a lot of stabilizing exercises can help this person.
Yeah.
Is there a way that he can differentiate for himself whether or not it's something that he may be able to help by himself or something that he absolutely needs either traditional medical care or chiropractic care?
Usually it's like if it's not getting better in a week or two doing it at home, get some help. Like there's a lot of people who are like, yeah, I've dealt with this for 10 years. What were you doing 9.5 years ago? Like, just there's people out here who know how to help you. Like, why suffer? So if you're not getting better at home, like just get some professional help. And sometimes, an adjustment can help. Sometimes like more targeted physical therapy can help. You get a personal trainer that could help. There's a lot of things that you just need an extra set of eyes or an extra set of hands to get a second opinion on. No reason to suffer.
Right. Well, I think some people, they either think there's nothing they can do to help, or they just learn to live with it. Or some, it's all, I don't want to say laziness. Sometimes it is laziness. They're so used to it. They're like, I'll just deal with it. And they come to you when they're screaming in pain. So in my previous podcast, I did something with another TikToker. His name is Iron Tamer, Dave Whitley. And he said a quote that I don't believe was from him, but I use all the time. He said, if you listen to your body's whispers, you won't have to hear its screams. So listen to your body's whispers.
Very insightful. I like that. I'm probably going to steal that and use it in my patients.
I stole it. I stole it, and I forgot the original source, and it's on my YouTube. So
it's good.
That's a thing. I think a lot of people will try that. A lot of people will try helping themselves, and maybe some things on YouTube or something they can find online. Is there, because there's always this worry that some people have, is there a sign, in your opinion, to where they should even try that? They should get medical care right away, other than the obvious ones like you're bleeding out or something. But it's
Yeah.
like if you notice
Yeah.
this
Yeah.
this feeling, I would get to the chiropractor as soon as possible or get to a hospital as soon as possible. Do you have any warning signs you can give people off the top of your head?
A lot of people are like, oh, I have sciatica. If the pain goes past your knee down into the leg or the foot, get some help right away. If you have
Okay.
weakness, like, oh yeah, my leg has been hurting, but now like my foot drags when I walk. Yeah, you need an MRI right now. Or like in the hands, or like, yeah, like my hand goes to sleep, but lately it's been hard to hold my coffee cup. Right away. Go right away. And things that
Possibly
are
brain blockage.
uh, more like a really severe nerve compression. So
Okay.
your nerves provide efferent and afferent signals. Basically, it's like a two-way road. One is a signal going to my hands, and one is a signal from my hands going to my brain. And so when I feel something, that sensation starts here and goes to my brain. And when I tell my brain to flex my hand, that's my brain to my hand. And so there's a two-way street. And so when it gets cut off and you start to feel tingly, that's the pathway going up to my brain getting cut off. And when it starts to get weak, it's the pathway from my brain to my hand getting cut off. And so it kind of progresses. When you have weakness, it's far progressed.
Okay. Um, that makes a lot of sense, and that's something I think a lot of people can use. If you feel those
Mm-hmm.
warning signs, don't try stuff at home. Try to get some help right away, and especially
Mm-hmm.
if you're able to financially and things. I don't think it would hurt to
Yeah.
if
Well,
you're worried
a
about
lot
that
of
to try it out.
a lot of insurances cover chiropractic nowadays. Like with the changes with healthcare legislation stuff, chiropractic is covered by most plans. And so you might have a crappy plan that has a huge deductible or whatever, but
Hmm.
insurance covers it. So you have insurance, it can cover it. Even people who have Medicaid or Medicare, there are chiropractors who help those people, and you could use your insurance. Sometimes the
Okay.
out of pocket is really cheap, like 10 or $20.
Right. So yeah, definitely worth to check it out if possible. And I'll bring this question up because you mentioned sciatica. This person was wondering what the difference was between slipped discs and sciatica.
So sciatica is more of a garbage can term that just all encompasses everything. Like
Okay.
people say sciatica who don't really know what they're talking about. They're like, oh, my back hurts. Like my back hurts. It's like, well, that's not technically sciatica. Sciatica is kind of an umbrella term. And so a slip disc can include sciatica. Sciatica
Okay.
basically means there's some sort of sciatic nerve pinch, and a slip disc can pinch a nerve going down your leg. And so that's sometimes. There's a lot of things can fall under the umbrella of sciatica.
I got you. Then that's really interesting. That's very informative. Now, and I should mention this before that question, but we were talking if at all possible and get up. Yeah, some people, the person they're worried about this because they think it's dangerous. And so I asked, is chiropractic work on the neck as dangerous as it looks?
Ah,
I
yes.
apologize if we, you're back. I froze for a second.
Can you hear me? It was getting kind of choppy.
Can you? Yeah, I can hear you fine.
Okay. Yeah. So I heard the question. It was just kind of like digital Hampton. So the question was, chiropractic looks dangerous on the neck. How safe is it?
Absolutely, yes. That is the question.
All right. So I would say if you're doing it on yourself, if you're doing one of these things, it's pretty non-specific, and you could hurt yourself. You could hurt the muscles and ligaments in your neck. But a chiropractor goes through a lot of training, like a lot. Most chiropractors get a bachelor's degree, a 4-year university degree, and then go on to 4 more years of chiropractic school. And so there's 8 years of science education that go behind this. And we practice a lot. And so it's very safe when performed by a chiropractor. The history of injuries that happen from a neck adjustment are surprisingly low. And there was a study that came out, or there was a claim that came out in like the 80s or 90s or something that said chiropractors can cause strokes, but that's been refuted twice. There's a massive study with hundreds of thousands of patients in Canada and the United States, and they, it was a meta study. So they looked at the history of these patients who've had a stroke. What were they doing before and after the stroke? And you're just as likely to have a stroke going to the bank or getting your hair cut or going to the medical doctor or walking down the street. And so there's no correlation between chiropractic and stroke. So there's headlines, clickbait articles that will every once in a while say, this chiropractor killed someone from a neck adjustment. It's very unfounded, very untrue. Chiropractic is very safe. In every research that's ever been happened, you are like 1,000 or 10,000 more times more likely to be injured from a normal dose of ibuprofen than a chiropractic adjustment, and ibuprofen is like really safe, or, like a over-the-counter dosage. And so it's very safe. Sometimes it looks scary. And I think we're kind of jaded by Bruce Lee movies and, Hollywood, crack the neck. Movies have been ruined for me because I know what it takes, and Hollywood doesn't get it right. So I don't think you could. I don't even think I could break someone's neck if I tried.
Okay, so that's an interesting point. If that helps alleviate people, if he was actually trying, he's not sure he could break your neck.
No, I know. I'm just weak. These hands.
No. Well, don't get any stronger. That's a good thing. That's not something you should train for.
I know. We're using biomechanics. We're going in the right direction. We're going through the joint. We're not going against the joint. We're doing it in the right way, so it's really unlikely to get injured if you do it correctly.
Some people may be wondering if they have an unusual medical condition. Do you know of any people that may not want to get chiropractic care, or no?
Yes. So sometimes people have a fusion. People will ask me all the time, like, hey, I have my C6 and C7 fused, either congenitally, meaning I was born with it, or surgically, like they actually put in some screws and pins and stuff. That joint is forever frozen and you can't adjust through that. I can work the bones above and below, and often that will be necessary because, let's use skeleton man again. So here's L5. If this thing gets fused, they say they fuse right here. So now forever, these two are not going to move again. Well, this one is going to move extra to pick up the slack from the lack of motion happening here. And so this one will probably start to degenerate over time, and it needs a little bit of help to make sure it doesn't get wonky. And so there are some cases that chiropractic is not a fit for, but most of the time people kind of self-select, and I don't see a lot of crazy stuff in my clinic.
Well, I get it. That makes a lot of sense. You mentioned earlier that sometimes people get adjustments, other times you give them stretches. And I've heard from some chiropractors that your chiropractor should be giving you some stretches or some kind of routine. Number one, so you agree with that?
I totally do.
Are there some stretches you think everyone should do? And I'll link that into this question. How often should we stretch? Is it necessary to do it daily?
I think one stretch that every person I've ever met needs it's called Brugger's stretch, or Brugger's relief position, named after a guy, Dr. Brugger. Because guys like to name stuff after themselves. I've done it on YouTube a whole bunch of times. You squeeze your shoulder blades together, you lower your shoulder blades, You externally rotate your hands, so palms up. You bring your arms back so you're feeling a stretch in your chest. Keep those shoulder blades squeezed, keep the shoulders down. You have a long, tall neck, and then you retract your chin like your double chin. And you hold it for 15 seconds. So what this is doing is it's exercising your deep cervical flexor. It's called longus colli. It's a muscle. You're exercising your rhomboids. It's also a muscle in between your shoulder blades. You're exercising your lower trapezius, which is a muscle underneath your shoulder blades, like below your shoulder blades. And you're stretching your pectoral muscles. You're stretching your upper trap, and you're stretching your suboccipital muscles behind your skull. And it counteracts a lot of the bad posture things we do in normal life. Especially TikTokers, we're also always looking down at our phones, and so it's I know, yeah, no, you're in this position quite a lot, and so it counteracts that. And there's a lot of people who they work on a computer, and so you do this stretch once an hour, and it helps train your posture to be good, but it also is very relieving when you have that tension in the back or the upper neck, because you are in this position too much.
Right. So it would help with what people consider a tech neck.
Exactly. 100%.
Okay. As famous as you made it sound, I had actually never heard of that before.
Oh, it's famous in the chiropractic and PT world. If you're a physical therapist or a chiropractor, you're like, oh, Dr. Brugger? Yeah.
Yeah.
But outside of that world, I know. He's some guy from Europe, like Sweden or Switzerland, that just named some stuff after himself.
Okay. No, that's really cool. Everyone check it out. Brugger's Stretch, especially because this will be on Spotify, iTunes. If you can't see what he's doing, check it out. Brugger's Stretch. I think it'd be very helpful.
Yeah. Now, I think that's a stretch that's everybody needs.
Everybody needs a Brugger Stretch. And you said once an hour?
Yeah. So if you're at a computer, like if you work 8 hours on a computer, once an hour will help relieve that. It's not necessary like if you are, running around and doing normal stuff, you probably don't need to do it once an hour. But if you're on your phone for TikTok for like 30 minutes or an hour, it's good to do that stretch for 15 seconds.
Okay. That's something actually I get asked about a lot, and you probably do too. Other than that, is there any other kind of stretch we can do while we're sitting down doing office work, especially if we work a 9-to-5 office job? Is there a sitting posture thing we can do, or is there a stretch we should do every hour? What's your opinion on that?
So that's a stretch you can do every hour. That's really easy. You could do it sitting. I'm sitting right now. Other ones you could do is like grab the edge of your seat or sit on your hands and lean your head to the side, ear to shoulder, and you just hang out. You feel the stretch. You should feel it all along the side of your neck from your ear to your shoulder. You just kind of hang out. You breathe a couple times. You could turn your head down. You'll feel in a different spot. You could rotate your head up. You'll feel in a different spot. That's a good one for the neck, kind of a lateral, the side of your neck.
Okay. So, and what about, is there a way that we can just improve our sitting posture? Should we try to sit up when we're working? Is there a certain kind of chair that's a magic chair that you can recommend?
Are you talking more for computer work or just in general?
Let's like someone has a desk job or they're in college and they spend a lot of time sitting down.
So if you're on the computer, try to get the middle of the screen about eye level. Okay. So you might have to elevate, put the computer on a couple textbooks. If you're on a laptop and you do that, now the keyboard is so high, I'm going to have bad wrist posture. That's going to make, my wrist get pinched, could turn to carpal tunnel. So you might need like a wireless keyboard you plug in, so you have your wrists in a neutral position too. But in general, when you're having good posture, your ear should line up with your shoulder. And so when you're looking at you from the side, that ear and shoulder should be in a straight line. If your head is out in front of your body, the ear will be out in front of the shoulder. And so you could tell where a good posture is. And a lot of it has to do with shoulder and upper back. So a really good tip I've taken to heart for posture correction is imagine you have a balloon tied to your chest, kind of right between your pecs. Imagine there's a balloon there and it's pulling straight up, not out, but up. And it pulls you up. So your chest kind of elevates and it just naturally puts you into a better position. And that's a way that can just be a simple way to check your posture. And sometimes I will actually physically grab my shirt and pull up. And so I could kind of feel that elongation of the back, but it also puts me in a good position so that I'm not, hunchy all the time.
I got you. Okay. By the way, I was typing, I was writing down notes. I like that. Ear lines up with the shoulder.
Yeah.
Actually, this reminds me of a conversation I had. It was online. Someone left a comment, and he was very polite. But I'd like to get your opinion on that. He, I believe, was a physical therapist. He said there was, he made it seem like there was a consensus among physical therapists that your posture does not correlate with pain. It doesn't really, bad posture doesn't cause pain. Is that something you would agree with?
I would agree with
Okay.
that. So a lot of times people get so caught up in posture that they overlook function. And so, people with a really bad scoliosis or people with a really kyphotic spine, meaning I'm really hunched like this, just because your spine is doing that doesn't mean you're going to have pain. And it doesn't mean that you're going to not be able to do the things you want to do.
Okay.
And so a lot of times when someone comes into my office, I will ask them, what's your goal? What do you want? Is it more of a pain relief, or is it more of, do you want some sort of function? Meaning, I want to get back to the sport I like, or I want to get back to playing with my kids, or I want to be able to study without having neck pain and headaches. And so it's a different way to look at it, pain versus function. And in general, if you function well, you won't hurt. And so they go together, but they're separate. And so the function will follow the pain and the pain will follow the function, but it doesn't have to do so much with how bad of a posture you have, but it often does, because a bad posture can lead to bad function, which leads to more pain.
Okay. So just to clarify, or not to clarify, but to summarize that, posture doesn't necessarily mean you'll be in pain, and it's not as important as some people think it is, but it can lead to pain. Is that a summary?
Exactly. 100%.
Right.
So a lot
And
of people who like, yeah, like I feel all hunchy and my back hurts and the between my shoulder blades burns and I always have headaches. Yeah, you've entered the world of a dysfunctional spine and muscles, and now it hurts. But
I
there are
see.
some people who have a very hunchy spine and have no pain at all. And so
Right.
yeah, you like ask yourself what your goal is. Is your goal to be aesthetically pleasing? I don't want the hunch in my back. Well, that's something to fight for, and you could train your way out of that. If your goal is just for pain relief, you might have a different path. If your goal is more for functional relief, you might have a different path.
Right. That's actually a good point. And when he mentioned that, that was actually the first. I had never really, I never really did posture work for my pain. Again, I didn't really. My posture probably isn't perfect, but I never really had pain from it. So
Yeah,
I thought about it for a second. I'm like, that's something most people, if you went to a bar and told them that, they would disagree. Like, no, my posture is definitely causing me pain. I had a car accident. Now I'm a hunchback. But I thought about it for just like a second. I'm like, you know what? I can actually see that. I can actually see that. And for some people that want to be aesthetically pleasing, I'll just mention that. Yeah, I think that's actually a really good point that people should spread, that our posture and just in general, like everything else we do, doesn't have to be perfect. If it works for what we have, that's great. Now, some people might want really good posture, and it's not necessarily vain. Like, you may be a business leader, you may be a team leader, and you want to project. You want people to have confidence in you. You don't. And it's not just about you seeming powerful. You want people to believe in you so you can take care of them. So that's a very valid thing
100%.
if you want to have good
100%.
posture for that.
And it
Makes a
goes
lot of
even
sense.
deeper than that too. When you have a good posture, upright, chest up, solid posture, you project that confidence, but that also plays with your brain to like make you a little bit happier, and versus kind of the slouchy, hunched, I'm kind of anxious and sad. And so there's a brain component to this. I've listened to a few neurologists and psychology talk about this. Just a weird phenomenon that happens when you have good posture. You can change what your brain is feeling. It's kind of a trick. It's not a long lasting thing. Like, you can't fix your depression with good posture, but it's more of like, it's kind of cool. It could change your mood even.
Right. And that's actually a good point. Beyond pain, are there other significant negative side effects from posture that could possibly happen? Like, could we reduce blood flow to the brain, something like that?
Yeah, maybe. Probably not super a lot, but a big one that people notice is it having your shoulders compress inwards kind of decreases your lung capacity. And so when you have good posture, you can take a deeper breath. And so, like, long distance runners, like marathoners and stuff like that, if they have a hunchy back while they're running, it's harder for them to keep that stamina up. Whereas if they bring their shoulders back just a tiny bit, their lung capacity is a little bit easier. You don't have to fight it as hard. The accessory muscles that help you breathe don't have to fight so hard. And so there's side effects of better lung capacity. And that's a really easy one.
Okay, that makes a lot of sense. Because I was thinking about, you mentioned earlier on, I asked common issues everyone has, and people, the reason why a lot of people go to chiropractors is lower back pain, and you also mentioned headaches. So if it's not necessarily from posture, what are the causes of headaches that you've seen?
Well, there's a lot of people who just treat their neck really bad. If you've been in a car accident before, there's a significant amount of force that goes through the head if you've had a whiplash. Sometimes tissues can get torn, like ligaments or tendons or actual muscle tissue. People have degeneration that happens because they've had bad biomechanics for years. I see on TikTok all the time, people tag me all the time, people like popping their own neck and stuff like that. It's like, you could get away with that a few times, maybe even a lot of times, but there's going to be a point where you hurt yourself, or you've made everything so loose that the next time you're in an accident, a slip and fall, something simple as like walking up the stairs and you think there's one more step, and so you take that weird step where you hesitate. Those sort of weird, dumb things can hurt you when your neck is not stable. And so there's a lot of weird things I see with necks, but the things that cause headaches a lot are usually tight, painful cervical muscles, the muscles along the spine that go up and down, muscles that are behind your head, right underneath your skull. Those get really tight and painful. And they refer pain into the head and face. And so people will like, oh gosh, my head and neck just hurt so bad. And then a lot of people will develop an imbalance where, C1 and C2 are rock solid. They don't move very much. C5 and 6 move really, really well. And so it looks like they have great range of motion, but the very top of their neck is stuck. It's just not moving. And so by freeing up those joints, now everything moves together. A lot of times headaches magically go away, and it's just biomechanics and muscles not compensating and things like that.
Okay, that's great. And just to reiterate, because I feel like this is an important point, should people ever crack their own necks, work on their own necks?
So let me say this.
Okay.
I think that if I'm going through a normal range of motion and I hear a neck pop, no big deal. If I am putting my hands on my neck or my chin and putting force into that, I think that's a little dangerous. If I am stretching and I add a little bit of extra stretch, pop, 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 I don't think that's very dangerous, but I'm putting an excessive amount. I think that could be dangerous. So if you are trying to pop your neck because you like the pop sound, don't do that. What are you doing? But if you are trying to stretch and you hear a pop sound because you're stretching, cool. Who cares? That's fine and healthy. Your spine is supposed to make those sounds. It's just normal. It's just physiology. It's not anything magic or special.
I got you. That's a very good answer, I think. So normal range of motion, okay. But if you like crack, don't get addicted to crack. That's
I know. I'm a chiropractor. I'm very addicted to crack.
So as we close in, because I think Dr. Cooper has to do something in 15 minutes or so, we'll get to some of the more specific questions. And there were a couple of them that I was unfamiliar with. So I do want to cover, and there was one person, I'm not familiar with this thing at all. You may have to correct my pronunciation. Ankylosing spondylitis?
Yes.
Anything else other than workout, stretch, and diet, please?
So ankylosing spondylitis is a genetic condition. You're just born with the gene, you're going to get it. It's usually hereditary. So if your dad had it, your grandpa had it, you're probably going to get it. It's more common in boys. So men get it more than girls, but girls get it too, not super often. But it's a condition where your spine starts to fuse. And so on a normal spine, there's space in between every joint, every vertebra, and they're supposed to move on each other. Ankylosing spondylitis, there's spurs that grow off from the top and bottom, and they meet in the middle, and so you become fused all the way up, and it will go the whole length of the spine, from the butt to the neck. And so long-term ankylosing spondylitis usually results in someone fully fused, and it's very uncomfortable while it happens because it's an inflammatory condition. So it means that there's inflammation happening, and inflammation hurts. And so it hurts. It's always in pain. But I had a friend who was going through chiropractic school with me who had ankylosing spondylitis. That means his dad did and his grandpa did. And his grandpa was fused into a sitting position. And so when he was in a chair, he was perfectly fine, but he couldn't lay on his back and he couldn't stand up tall. If he stood up, he was in a 90-degree angle because he fused that way. And so his grandson, my friend, was like, I am not going to let this be me. And so he went to chiropractic school. And what we've learned with, it's mostly, I haven't read any studies on this. So this is mostly clinical experience. Keeping a spine mobile will be the best solution for ankylosing spondylitis. It's not we're really managing the case. There's no cure for this. So you can't cure this thing, but you can manage the pain. And what we were talking about earlier in this podcast with function versus pain, with ankylosing spondylitis, if you can keep the spine highly functioning, then a lot of the pain is not as bad. And you will have good days and bad days. You'll have good weeks and bad weeks. But if you can keep the trend with a mobile spine, that's where you're going to be the best off. So something like yoga or the back bend exercise that Hampton does, where he arches his back, like things like that are really beneficial to someone with ankylosing spondylitis. You just want more motion. The more motion you have in the spine, the better you're going to feel. And sometimes it's a painful thing where you're like, oh, I really don't want to move today. Do it anyways. You're going to feel better afterwards. But you have to make sure that you're working with, usually ankylosing spondylitis will have some sort of arthritis doctor, like a rheumatologist or some doctor who specializes in that, and they will help guide them through. There might be some steroid that they're taking, like prednisone or corticosteroid or something like that, where it reduces the inflammation. But it's a very manageable case, but you have to start young. Once it progresses to a point where you're fused, chiropractor is not the solution. But
Ah,
in early on, we can help a lot.
okay. So ankylosing spondylitis. Check out a chiropractor. Check out your if you have it, and back bends. I'm also a fan of the twist holds. And if you can't find
Yes.
anything for back bend, look up the wheel pose. I think it's what the yoga people call it. And there are also, of course, easier variations. There's an easier variation for anything. So
Mm-hmm.
if you look at that
And
and
with
you think you can do it, yeah,
and with
there's other ones.
ankylosing spondylitis, you might not be able to go as deep as you see
Mm-hmm.
some of these poses on. But
Mm-hmm.
what we're trying to do is any motion. Any motion will be better than nothing. And so get off the couch, move more, you'll feel a lot better.
And just to clarify, are we talking go into these poses and hold, or do you recommend medium to high repetition?
Um, I would probably say the repetition one.
Okay.
It's more about the motion, not so much the muscle strengthening. We just want more motion.
Okay. That's actually somewhat related to this question that again I get a lot of these questions a lot, but I'm very curious about your
You're a
opinions on this
popular
because
guy.
well, for some, I kind of jokingly complain about this for someone who is a very, very low tier internet celebrity compared to like, the higher echelon people, very, very low tier. I wonder if they sit down at 2 a.m. and answer all these DMs because I feel like I get a lot of them. And it's not fan mail. It's not like Hampton. I'm not complaining about that. It's like really long, like things that I'm not even sure how to answer. And it's not about fitness. It's like who am I? And who are you? So I get a lot of these questions a lot, but this one that I see every once in a while, and I always tell them it's controversial because I've read different studies on both sides. For a younger person, either a teenager or even preteen, do you think weightlifting can affect their growth? And is there a certain age to wait before start?
So I don't have a lot of knowledge in weightlifting as an adolescent. But I would say that in general, if you keep it safe, that's where it's going to be beneficial. So there's a lot of people that I treat who injured their back in high school because the weightlifting coach was the PE teacher. And
Mhm.
I mean, not to diss on PE teachers, but they don't really know proper form. And so this, like, go harder, go. Like that's not the right way to build muscle.
Mhm.
And so if you go at it safely, I think it could be beneficial. If you go at it not safe, it could really jack you up for the long term. Sometimes these old injuries turn into problems 20 years down the road. And so it's like, don't injure yourself needlessly when you're 16. Like,
Right.
stay strong, stay functional. That's one reason, Hampton, why I really like your stuff is because a lot of your stuff is very functional based. These isometric holds, these building strength around the joint is absolutely wonderful. And I think that's the best form of strength building exercise. And so if you're looking for muscle mass, it might be harder to get beefy when you're doing the Hampton style exercises. But when you're looking for strength and function, man, like it just doesn't get better than what you provide. So, it depends on what your goal is. I guess I always come back to what your goal is, but it's, in general, I don't think it's clear cut. Definitely don't weightlift as a kid, and I definitely don't think it's definitely weightlift as a kid. But I think if you do it safely, it could be beneficial to you.
Right. And sometimes the goals we have, because we have some viewers that are like 13 or younger,
Yeah.
sometimes the goals you have now, you even as little as a year, half a year, and realize that goal was really stupid. So don't hurt yourself with that goal. Like if like some 12-year-olds have a goal of lifting 1,000 pounds by the time they're
Yeah.
15,
Yeah.
you have a lot of time, 20s, 30s, to get to that point if you choose.
Yeah.
You don't have to do it
Yeah.
now. I know you've only lived 3 years. You're going to live that same time multiple times. Be safe, strong. Don't hurt yourself trying to impress a girl that you're going to forget in a few years. That applies for older people too.
Amen, brother.
That's
Amen.
not just young kids. The people my age.
100%. How many times have I done something stupid to impress
100%.
someone else that I paid for it afterwards? So dumb. I've done so many dumb things.
Right. And it's not even people we like sometimes. It's people that are doing us that won't like.
Oh, I know.
I'm going to impress them. You do the thing. They still don't like you. They still don't like you, but you've hurt yourself.
I know.
So
not worth it. Definitely not worth it.
So as we close up, I thought it was fun other than cool. Hairlines matter.
Did I lose you? Can you hear me?
Oh, yeah. You froze up, but I can hear you now. Can you hear me?
Oh, I can hear you again.
All right. I think we're back.
Cool.
Did you hear the question?
I didn't.
Okay. Well, that's good because I want to add some buildup for it. This is the funniest question other than how did you get so cool?
Okay.
This is clearly very important to health. Do hairlines matter?
Who's asking?
Some guy on Instagram or some girl. I don't know.
Girl?
A user on Instagram. A user on Instagram. I can't always tell.
Oh, man. Jeez. Oh, my God.
Matter for what?
I know. Yeah. Like, you want to be one of those wise guys? You know, I don't know, man. You've seen pictures of Elon Musk be pre-hair transplant and after hair transplant.
You got a hair transplant?
Oh, dude, look up the pre and post. Yeah.
I'll look up.
Yeah.
So was he, did he have a receding hairline or something? He got a hair transplant?
He had a receding hairline, thinning on top and kind of on the bald spot at the crown of his head. Now he looks like Tony Stark or something.
Wow.
So I don't know. Maybe.
I don't know. Okay, well, if anyone, I mean, like people have asked me for my hairline. It's visible in all my videos, other than the sides. So if you want to ask, like, what does it matter? If you're going to be a hair model, yes, it matters.
Yeah,
if you're a shampoo model, yes, it does matter. It depends. In general, it's largely genetic, unless you're poisoning yourself or something.
Yeah.
In which case, yeah, I mean, I think some poisons can cause you to lose hair, or if you have, I don't know. In general, it does not matter. Your hair is your hair. If you want, you can always shave your head, boy or girl.
That's true. And I think here's my real answer. I had a little chance to think about it. I think it's important to love yourself.
Mm-hmm.
In general, we judge ourselves based off of other people a lot.
Mm-hmm.
How many followers do I have? How many followers do they have? How many likes do they get on this post? I look at the buff guys on that come through my feed and I'm like, gosh, why can't I be buff? Why do I have such a dad bod? Or you look at these, like, man, look at that hairline. I would love his hair. I think it's important to show yourself some love. You're worth a lot more than just your hairline. There's a lot that you can provide to the community, to your friends, to the people that love you and the people that you love. That is a lot more than just your looks. And so I think it's important to love yourself too.
Very important to love yourself. And again, if it's hairline, not a whole lot you can do, but stuff about being buff. I talk about this thing where it's like, be happy with who you are. And that as a young male, I can diss on young males. They say, no, I want to push myself. I want to hate myself so I can get better. And my response to that is you can love yourself and push yourself at the same time. You can try to be the best in the world, but still realize that, hey, even if I don't get there, I'm not less of a human being. And
100%.
I don't think that takes away from or your motivation. You can do the same time and love your and push.
I agree. I totally agree.
Well, it's closing in around an hour. And I think I'm starting to lose you again. So I'm sorry if I'm being choppy and being Robohampton right now. But is there anything you'd like to tell the audience before we sign off?
Yeah, I'm on TikTok. I'm on YouTube. I'm on Instagram. If you go find me, my @name is usually at cascade.chiro. And I I don't know. I care about you. So if there's anything I could do to help, I'd love to answer questions. But yeah, I am not one of those guys who will ghost you. I will definitely reach out back if you reach out to me.
Awesome stuff. You can find him at cascade.chiro. Great TikTok stuff, great Instagram stuff. I really like his things, and I will check out that a couple of stretches. I took notes the entire podcast. I'll check out some of the things you mentioned. Thank you so much for
Cool.
coming on, Dr.
Yeah, thanks
Cooper.
for having me. I really,
I,
really appreciate it. I felt a little fanboyish when you asked me. I was like, oh my gosh, Hampton. So it was awesome.
Same here. Same here. Like all my guests, I think of as celebrities. I'm like, they're gonna
Oh
sit
my
down and talk
gosh.
with me. That's awesome. So no, thank you so much. You are a rock star to me.
I appreciate
And
that.
you mentioned having a dad bod. Dad bods are in. Dude, dad bods are in.
Hey, hey, hope that trend
People
stays.
want dad bods. Right, right. Well, all right. Well, I'm going to end the recording here. Let's see. I lost the button. I'm kind of a young boomer. All right. So we're going to end out. Thank you so much for joining us.
Take it easy.
And now I'll take us off the stream.